What the study says.
Have you ever been miserable with a stuffed-up nose and thought, if only there was a highly entertaining, completely natural way to clear my sinuses without medication? Welcome back to What the Study Says. I'm Dr. Kai.
I'm Dr. May.
And today we are diving into a study that actually won the Ig Nobel Prize. For anyone unfamiliar, the Ig Nobel is a satirical award honoring imaginative research that, first makes you laugh and then makes you think.
Right, and the 2021 Medicine Prize winner absolutely delivers on both of those fronts. We're looking at a paper titled, literally, Can Sex Improve Nasal Function?
Which, it sounds like a joke, right?
It does. But what's fascinating is this isn't exactly a new concept. Like if we rewind to 1897, Sigmund Freud and his closest friend, an ear, nose, and throat doctor named Wilhelm Flies, they theorized a nasogenital connection.
Wait, so they seriously thought your nose and your genitals were like physically wired together?
They did. Flies believed there was specific genital spots located on the turbinates.
The turbinates.
Yeah, those are the small spongy bone structures inside your nasal passages that warm the air you breathe. It was taken so seriously that Freud even referred a patient for nasal surgery.
Oh, wow. Let me guess, that did not go well.
Total disaster. He was trying to cure a supposed nasal reflex neurosis, and it left the patient with recurrent bleeding and a completely disfigured nose.
That is horrifying. It really highlights how far medicine has come from just guessing based on a hunch. 19th century medicine was basically doctors throwing darts in the dark.
Pretty much.
So how did modern researchers actually test this connection safely without, repeating Freud's disastrous mistakes?
Well, for this 2020 study, they went with a much more observational approach. Researchers recruited 18 couples and sent them home with portable medical devices.
Sent them home with gear to measure their nasal airflow and resistance.
Exactly, along with subjective symptom scales. The couples took measurements at 5 specific intervals. Right before sex, immediately after climax, and then at 30, 60, and 180 minutes later.
Okay, and to make it a true scientific comparison, the very next day, they repeated those exact same intervals, right?
Right. But this time, using a standard over-the-counter decongestant spray instead of having intercourse.
And what is the punchline here?
The results are genuinely surprising. Intercourse ending in climax improved nasal breathing to the exact same degree as the medical nasal spray.
No way. It matched the spray.
It really did, for up to 60 minutes, actually, with peak airflow hitting right around the 30-minute mark.
It actually worked. That is insane. But I'm assuming the spray eventually beat the natural method in the long run.
Yeah, that's the catch. By the 3-hour mark, the sex group's nasal resistance had completely returned to baseline, whereas the nasal spray just kept working.
I see.
And crucially, this only worked for participants who actually had a pre-existing stuffed nose. Like specifically a score of over 30 on the Nasal Obstruction Symptom Evaluation Scale.
Oh, so if your nose was already clear, it didn't give you super breathing or anything.
Right, it didn't do much.
So why does this happen? My first thought is that, well, sex is physical exercise.
Yeah.
Getting your heart rate up clears you out, just like going for a hard run on the treadmill.
You'd think so, but it's actually much more nuanced than a standard cardio workout. To understand why, you have to realize that a stuffed nose usually isn't just full of mucus.
Right. It's mostly swollen tissue, isn't it?
Exactly. It's caused by swollen blood vessels inside the nasal passages. So sexual arousal and climax trigger a highly complex interaction between your sympathetic nervous system.
That's your fight or flight response.
Right. And your parasympathetic system, which is your rest and digest mode.
Okay, so it's like a neurological teeter-totter. The arousal pushes the sympathetic system up, which physically shrinks those swollen blood vessels in your nose and opens the airway.
Yes. And then the climax triggers the parasympathetic system. That's a great way to look at it. The opposing actions of those two nervous systems during a climax create this uniquely prolonged decongestant effect. So it's not just the blood pumping. It's the specific nerve signals commanding those nasal vessels to constrict.
A climax can naturally clear a stuffed nose for up to an hour, matching the initial effectiveness of a chemical spray. That is just a pretty incredible biological quirk.
It really is, which raises a really provocative question, one the researchers themselves point out for future exploration.
Oh, what are they wondering now?
Well, if the climax is the key trigger for these nervous system reflexes, could solo activities work just as well?
Wait, seriously, they put that in the paper?
They did. It potentially offers a totally natural, readily available cure for sinus headaches.
A completely natural, highly entertaining alternative to the pharmacy aisle. Well, if you enjoyed this deep dive into the research, please make sure to subscribe to and share the channel. Next time you reach for that nasal spray, just remember you might have other options.